Hey, Dr. Mike here, and today I want to go over some very simple but very effective neck stretches. You know, one of the things that I've seen in my practice for doing this 30 years is that with the lumbar spine, with the lower back, it's pretty easy to stretch using yoga. I call it the Awakening series of yoga, and I've done a video on this before, so you could check that out if you'd like, either on a website or Facebook page or on YouTube. But stretching the neck is kind of tricky, you know, so anything from the mid-shoulder blades up is a pretty tricky area to stretch. But there's two really good stretches that I like to share with my patients, especially those patients who have neck pain, shoulder pain, arm, hand numbness, even things like headaches or tension in the neck, upper back, and shoulders. So the first thing I always go over is a move called circumduction, which is a move that a lot of people in the healthcare space teach, whether it's in an aerobics class, in a spin class, in a taekwondo class, or a lot of classes, a lot of teachers, a lot of instructors will teach this move called circumduction. It looks like this. You've probably seen it before. The problem with this move is that it's all 6 ranges of motion at once, and it's really not a great move. It puts a lot of stress on the discs. It puts a lot of stress on the cartilage and the nerves in the spine. So you really want to stay away from that move. It's called circumduction. I wouldn't do it. The best thing to do is what we call quarter turns or half turns. And so what you do is you go chin to chest, and then you just roll about a quarter of the way, nice and slow, keeping your shoulders down. And you want to feel that deep stretch into your shoulders and into your neck. And you could come up to almost half. A lot of times I like to do this in the shower. You know, I'm taking a shower with the hot water running on my neck and shoulders. So quarter turns, those are great. That's a great start. The next stretch that I like to teach is a side bending stretch with rotation. Now, this stretch is very tricky in that if you don't do it exactly right, you won't feel the effects. And it took me a while to figure this out. Best way to do this is in front of a mirror so that you could see yourself. So what you want to do with this stretch is the first thing you want to do is side bend as far as you can. In other words, you're trying to touch your ear to your opposite shoulder, and you're going to go as far as you can until you can't go further. And once you feel like you've stopped, then you're going to rotate your chin to the opposite shoulder, and you'll feel this tight rope from the base of your skull. This is called the mastoid process of your occiput, which is the base of your skull. It's right back here behind your neck. That muscle runs all the way down into your clavicle, your shoulder, and into your shoulder blade. And so, again, it's side bend, max, and then rotate. If you go into rotation too early, you won't feel it. And you'll think you're wasting your time because you won't feel a thing. Sometimes I also recommend grabbing the end of the chair or the bench so that you could traction the shoulder down while you're doing it. So watch. It's side bend. My nose is straight ahead, right? A lot of times when I ask people to side bend, I see this. And they start to look, right? Because they have limited side bend. I don't care if it's limited or not. Just do side bend first. Side bend first. Max side bend. I'm tractioning the shoulder down by holding on, and I'm kind of leaning away, right? I'm relaxing the shoulder fully. Side bend into rotation, and hold that for 15 to 20 or 30 seconds. I'm telling you, it's remarkable what that stretch can do for you. So remember, stay informed and get adjusted.